Hello, my name is Vrinda Devani, and my co-presenter is Geetika Kumar. And we are here to present our research on the effect of Ayurvedic self-massage technique, also known as Abhyanga in Sanskrit, with an Ayurvedic herbalized oil on perceived stress, sleep disturbance, and overall quality of life. Our financial disclosure is that funding has been provided by Banyan Botanicals. We wanted to start with a little bit of a background on Ayurveda. Ayurveda is an ancient science that originated in India more than 3,000 years ago. It utilizes herbal therapies, body work, diet, and lifestyle approaches, including yoga and breath work called pranayam. The term Ayurveda is derived from two words, Ayur meaning life and Veda meaning science or knowledge. Together, then, this word means the science of life or the knowledge of life. In Ayurveda, we look at the balance of the 5 energies, which come together to form 3 main energies of Vata, Pitta, and Kapha. The 5 elements are space, ether, fire, water, and earth. Air and space combine to make Vata, fire makes Pitta, and Kapha is mainly derived from water and earth. Simply put, in Ayurveda, we look at health as a balance of these elements in the digestive fire, and in disease and disorders when there's imbalance of these elements in the digestive fire. Abhyanga is a therapy, part of a larger group of therapies called snehana or oleation. Abhyanga is said to calm the ether and air elements or vata dosha. Snehana also brings the elements from the periphery and metabolic waste from the periphery back to the GI tract so it can be properly eliminated. It also calms the fire element or the pitta dosha. And there are 2 main categories. It can be external as well as internal. External includes the massage techniques or creating oil pools on various parts of the body, or it can be internal, such as ingestion of various oils. In Sanskrit, Abhyanga means the massage of the body's limbs or glowing body. Unique to Ayurveda is that it can be done by a therapist or by the individual themselves. Massage done is usually uses generous amounts of warm oil, and that gives a grounding, nourishing, calming, and strengthening effect. The oil that is used is usually determined by the individual's body and imbalances, and usually the oil is infused with herbs and warmed. It is an integral part of the daily routine. But it is also part of more cleansing therapies like panchakarma, which is a detoxification rejuvenation therapy. And in this case, it enhances circulation lymph in addition to mobilizing the excess energies from the periphery and mobilizing toxins from the periphery. According to tradition, the benefits of Abhyanga include decrease effects of aging, relieve tiredness, aches, and pains, improve vision, nourish the body tissues, induce good sleep, improve skin tone and complexion, maintain good physique. And of note, we've only found anecdotal benefits in the literature and in the classical texts of Ayurveda. We did not find any modern research that has proven the benefits of Abhyanga. Therefore, we had to deduce the mechanism of action from research done on Western massage techniques. As many of you are aware, the benefits of massage can be grouped from various sources. One is biomechanical, reducing the adhesion and muscle spasms, stimulating proprioceptors and increasing blood supply. Physiological, including increasing parasympathetic activity. Neurological, including decreasing muscle tension and reducing neuromuscular excitability. And certainly everyone's well aware of the psychological benefits of increasing dopamine, decreasing norepinephrine, and thereby decreasing anxiety, increasing relaxation, and decreasing stress. So our goals for this study were to evaluate the effects of Abhyanga therapy using an herbal oil blend on 3 main parameters of stress, sleep, and overall quality of life. We wanted to compare the outcomes of Abhyanga self-massage with herbalized oil, with professional massage therapy with herbalized oil, and our controlled treatment of massaging without the use of any oil, also known as dry massage. Our study design include this primary outcomes of perceived stress scale for stress, a questionnaire, a validated questionnaire for a sleep disturbance for the Promise Item Bank version 1 from the NIH, and the World Health Organization's Quality of Life questionnaire, which looked at 5 main domains of general health, physical, psychological, social, and environmental domains. Our secondary outcomes were blood pressure, pulse rate, and the self-reported Ayurvedic quiz designed by Bain Botanicals. Our inclusion criteria included our participants had to be above the age of 18 years and below 69 years of age. At baseline, they had to be moderately troubled with stress, and we assessed this using the perceived stress scale, the short questionnaire. They had to be willing and able to follow the instructions and perform the massage technique as specified, and they had to be willing to follow some simple and diet lifestyle changes that we provided. Our exclusion criteria included they had to be they could not be under the influence of stress medication. They could not have been medically diagnosed with any mental or substance abuse disorders. Exclusion criteria also included blood pressure medications, having surgery within the previous 2 weeks of participation, being pregnant or breastfeeding, or being on their menstrual cycle during the intervention. And this is due to the tradition of Ayurveda, and it is contraindicated to do Abhyanga when you're on your menstrual cycle. So with that, I'm going to hand it off to my co-presenter, Geetika.
Thank you, Vrinda, and good evening, everyone. I am Geetika Kumar, and I will go over the methods, results, and discussion for the study today. Starting with the screening procedure, here is the flow chart of the screening procedure. On total, we screened about 300 participants, of which 227 met the inclusion-exclusion criteria, and of them, 49 were enrolled into the study. Each participant was randomly assigned to one of the 3 groups. In Abhyanga, there were 18 participants. In professional massage, there were 15, and control group, there were 16. 5 participants dropped out due to non-compliance to the instructions. 1 of them belonged to the Abhyanga group, and 4 belonged to the control group. Overall, we had 44 participants who successfully completed the 2-week trial. This slide goes into the demographics of our participants. As you can see, majority of them were female and were in the age range of 40 to 50 years. The males were also in the similar age range. Next, we go deeper into the methods for the study. On the first visit, which was recorded as day 0, the participants visited the researcher in Albuquerque, New Mexico, and were asked to fill out the questionnaires for stress, sleep, and overall quality of life, along with the Ayurvedic profile quiz. They were also recorded for blood pressure and pulse rate. All participants were also given basic education about the study and were also advised to follow simple diet and lifestyle recommendations, such as eating warm-cooked foods, avoiding any major deadlines or any major stressors, avoiding air travel or long-distance trips, and having a good nightly sleep. The participants in Abhyanga group and professional massage group used daily massage oil by Bain Botanicals. This is an herbal blend of sesame, sunflower, coconut infused with these traditionally used Ayurvedic herbs. From days 1 to 14, the participants performed specific tasks in their respective groups. Starting with the Abhyanga group, the participants were given specific instructions on performing the technique on themselves for 30 minutes with the daily massage oil. They were each provided with a 34-ounce bottle, and the technique mainly involved strokes in circular clockwise motions, starting from the extremities, that is from hands and feet, and moving towards the abdomen. At the end of performing massage, they were recommended to have a shower after performing the technique to cleanse off the oil. The professional massage group participants visited the massage therapist twice a week. There were at least 48 hours break given between each massage visit, and the therapist also used the daily massage oil. And finally, the control group were asked to perform Abhyanga massage technique for 30 minutes daily without the use of oil, similar to a dry massage. On the last day of the 2-week trial, which was recorded as day 15, all participants came back to the operating facility in Albuquerque, New Mexico to meet with the researcher and were asked to complete the 3 questionnaires once again and were recorded for the blood pressure and pulse rate. Now, the next few slides will go over the results and discussion section. Starting with the results from perceived stress scale, the bar graph on the left shows difference in results from day 0 to day 15 and mean with standard error of mean for each treatment group along with the average percent change and the p-value. We did notice a significant change in Abhyanga and professional massage groups for decreasing stress levels. The control group, however, showed no significance. In intergroup analysis, significant difference was found among the three groups with a p-value of 0.0024, and the post-hoc analysis also revealed a significance in the Abhyanga versus control massage groups and the professional massage versus control groups. Moving on to the results of the second questionnaire, which is the PROMIS Sleep Disturbance Scale. All groups showed significant decrease in scores from day 0 to day 15. Also, in intergroup analysis, significant difference was found among the three groups with a p-value of 0.0062, and post-hoc analysis revealed significance between professional massage and control group only. Next is the third questionnaire, which is the WHO Quality of Life. In this one, an increase in score means an increase or an improvement in quality of life from day 0 to day 15. Abhyanga and professional massage groups showed significant improvement in overall quality of life. The control group, however, showed no significance. And in intergroup analysis, significant difference was found among the three groups with a p-value of 0.0024, and post-hoc analysis also revealed a significance in the Abhyanga versus control groups and also in the professional massage versus control group. Now, moving on to the secondary measures, which were the blood pressure and pulse rate. This table shows mean with the standard deviation of systolic and diastolic blood pressure, along with the p-values for each treatment group. We did not find any significant decrease in blood pressure in any of the three groups. As you can see the table here, most of the p-values were higher than 0.05. And we also noticed similar results with the pulse rate as well. As you can see, there wasn't any significant change in pulse rate from day 0 to day 15. Now that is the end of the results and discussion section. I will now pass it back to Vrinda to go over conclusion.
Thank you. So in conclusion, we saw that the effect of oil and self-touch with Abhyanga technique using the herbalized daily massage oil was significant in all three subjective parameters of decreasing stress levels, improving quality of sleep, and enhancing overall quality of life. There were no significant results noted in the secondary measures of blood pressure and pulse rate. And we were excited to see that the results inferred that performing Abhyanga every day for 30 minutes yields positive effects similar to those observed by having massage therapy twice a week. Now, as we all know, this is not feasible for most people due to scheduling and cost limitations. We're also very interested to see that significant results in control groups. It highlighted the power of simple touch on the body. Limitations of our study were that this is a pilot study, as you all can see. It was a small study and likely underpowered, and larger studies would be needed. There's an unequal distribution of gender and sample size, far more female participants, and so we would like to see further studies using more male participants. And this study was limited to subjective assessments for the primary outcomes. So we'd love to see biochemical markers and other objective measures in future studies to measure the outcomes. The strengths were that this was the first randomized controlled clinical trial to our knowledge to evaluate the effects of Abhyanga and to compare it with professional massage therapy. And there were promising significant results noticed even with such a small sample size. And with that, we want to thank you all. We especially want to thank Stanford University for inviting us to this conference. Thank you so much.